I work in the Children's Hospital in Madrid, and I work as a quality manager nurse. What I like to hear is the new issues, new things that are coming aboard on the therapies and the treatment that we have to learn on the excellence of care for the patients that we are transplanting.
I work on a hematology ward as a nurse, and I think it's important that we have a separate part for nurses, because we have a different kind of view in medicine than the doctors. For nurses, it's more important to see the patient's view than all the things we have to administrate to the patients. But it's important to hear what patients think. It's important for their supportive care and that kind of thing. So that's why I think it's more important to have apart sessions for nurses.
I received a bone marrow transplant 10 years ago. So they have asked me to talk about bone marrow transplant and bone marrow donation, not just in the point of view of a doctor, but in the point of view of a patient. It is very important this educational day, because like nurses are very important for patients, because like without them a patient wouldn't heal the illness.
I work at National Taiwan University of Stem Cell Transplantation Center. Today's topic is about my job. So I come from to learn foreign countries' care of transplantation patient.
I'm a nurse. I'm working on hematology unit of the Academical Medical Center in Nijmegen, Holland. I found out that there is a difference between people from the northern part of Europe and the southern part of Europe. How they talk about the family and how important family is in the treatment, and how they will have support for the family, and how important the meaning of the family is for the treatment.
I've travelled all the way from Australia. I live in Brisbane and I work at the Royal Brisbane Women's Hospital, so we're one of the biggest transplant centres in Australia. I'm a haematology nurse and a palliative care nurse, and I'm studying my PhD looking at trying to integrate palliative care in the haematology setting. So I'm here to sort of see what current research and practice is, and hoping that my research will make an impact in the future, and just seeing what's out there. So yeah, I'm enjoying it a lot. This is like the mecca for transplant nurses, and I've wanted to come here for years, so this is really great. I'm very excited.